Our NHS has only limited numbers of doctors, nurses and specialist equipment. Protect the NHS.
Save lives, fix testing and protect the NHS.
Protect the NHS.
Protect the ability of the NHS.
Throughout the COVID-19 pandemic, politicians have made clear that the number one priority is to protect the NHS. But right now, the health service is buckling under the strain of backlogged waiting lists, an overwhelmed ambulance service, and staff shortages.
We're certainly aware that harm is occurring to patients in the community who aren't being seen and assessed.
Anecdotally, more and more people are turning to the private sector for their care.
There just aren't enough physical beds in the hospital and there aren't enough staff.
We've been asked to put up with significant restrictions. But have they been enough? And can the NHS actually survive COVID-19? Since the first lockdowns in 2020, COVID has taken precedence in our health service. Elective procedures have been cancelled or postponed, and it's been harder to get a GP appointment. All of this has been having a knock-on impact on vital emergency services.
There's been a whole load of demand that's built up. A number of patients have not been seen for a long period of time. Routine investigations haven't happened. We're aware that surgery, there's long delays for elective care. Those patients who need new hips, need new knees, for example, instead of waiting a few months, they've waited years to have an operation. They become weaker. They tend to have more falls. So we are starting to see a number of patients who come to us because they haven't had the care they needed early enough on.
Ambulance waiting times are now above the pre-pandemic average in every English region. The average wait for an ambulance across all categories of severity stood at 58 minutes in November 2021, which is half an hour longer than at the start of 2020. Most of this increase has come at the expense of less severe call-outs, as services have had to prioritise those most in need.
What we're finding at the moment is that there are long delays at hospital offloading patients. Quite often, if I arrive at hospital with a patient at the back of my ambulance, I can see 6 or 8 ambulances ahead of me waiting to offload, and I know I'll be sat outside in the cold with a patient for several hours waiting to offload. And it's frustrating because you can hear the control room calling out quite regularly. We're holding calls, is anybody available? Normally, 20 minutes, half an hour later, I could go and be available for that call. We're not, we're all stuck there in a log jam. So as a paramedic working on a 12-hour shift, I would normally do maybe 6 or 7 incidents over the 12-hour shift. What's happening at the moment, we're doing probably 2 or 3 incidents.
Waiting times have also spiked for the most life-threatening injuries. The England average was 9 minutes and 10 seconds in November, which is 70 seconds longer than the 8-minute target time.
There have been some cases where patients have deteriorated in the back of an ambulance where perhaps if they'd been assessed earlier, that wouldn't have happened. There are a number of younger patients who sadly had a cardiac arrest and died. It's not uncommon for a patient who's fallen with a head injury to be held in the back of an ambulance, taken into the CT scanner, had a scan and then put back in the ambulance to be observed. The emergency departments are working really hard, but clearly there isn't sufficient capacity of the emergency department to look after all the patients they have in there already, plus this next group of patients.
Around 6 million people are on NHS England's waiting list for planned procedures, a new record. 1.4 million of those have been waiting more than 6 months, and over 300,000 have been waiting more than a year to be seen. As a result, in my reporting, I'm hearing that more and more patients are turning to private healthcare and paying for procedures themselves.
Although NHS England stopped publishing the number of cancelled operations in April last year, since the start of 2020, it's performed 4 million fewer planned procedures than would usually be expected, looking at the 2018 to 19 average. Diagnoses for key diseases have also taken a hit. There have been 42,000 fewer cancer diagnoses in England compared to 2018 to 19. 30% of people surveyed in November said they'd be more likely to consider paying for private healthcare than before the pandemic. We've also looked at the 2021 half-year results of a publicly listed healthcare company called Spire. Looking at patients who pay for private treatment themselves, rather than claiming on insurance, it showed 46.7% revenue growth on the first half of 2019.
Some opponents of the government, and one experienced NHS GP I've spoken to, have described this as a deliberate ideological attempt to turn patients towards private healthcare, accusing the government of privatising the NHS by stealth.
it allows for greater privatisation of the NHS
How?
through integrated care systems. There are 42 of these, and private bodies will be allowed to sit on those.
But there is little evidence that that is currently a political priority. In fact, Boris Johnson's government has spent vast political capital on raising taxes to fund clearing the NHS backlog, and service provision by the private sector seems to have stayed pretty level.
Before COVID-19, the NHS would spend about £10 billion a year, or 7% of its revenue budget, on services provided by the private sector. First of all, spending on private providers has remained broadly static over previous years. Secondly, private providers have played a role in things like tackling waiting lists under previous governments like New Labour. But perhaps most importantly, the key limiting factor in how much private care can be delivered is the workforce. There are very few private providers who have their own workforce that's hermetically sealed. They rely on NHS staff, and so if NHS staff are overworked, burnt out, and not willing to provide or able to provide extra care, I think there will be a limit to how much extra capacity the private sector will actually be able to provide.
At the same time, the NHS is struggling with staffing shortages, failing to attract enough new recruits, and losing nurses faster than ever.
The latest NHS vacancy statistics show that more than 1 in 10 nursing posts are vacant, which is nearly 40,000 jobs. During the first wave, the vacancy figures dropped because hospitals weren't recruiting. They were too busy focusing on COVID-19. Overall, nurse numbers are slowly increasing, but at the same time, more nurses are leaving the profession. Between April and September, around 14,000 nurses quit, which is 27% higher than the same time last year.
So for some, it will be a normal part of life. They'll be getting to retirement age or making different life choices. But for many, sadly, after years of trying to work without enough staff, and then to work for the last 18 months through both the COVID pandemic itself and then working many hours over and above what they should be doing to try and get the NHS social care services back up and running. For many of them, it's had such an impact on their mental health and well-being that they just can't cope anymore.
What do we want? Pay rise! When do we want it? Now!
Although they've confirmed that nurses will get a pay rise next year, it's later than it should be. They should be getting a pay rise in April. It needs to be substantial for nurses. It needs to attract, but it also needs to retain those people that are in the system. Substantial looked like 12.5% when that was really trying to just catch up with what's been lost over the last 10 years. We need a workforce plan that plans out for the future what staff we need, where, when, and what we need them to be doing. That plan doesn't exist at the moment, and the government really does need to address that so that it becomes accountable for having a plan and delivering on that plan.
We approached NHS England to comment on this report. Professor Stephen Powis, NHS England's National Medical Director, said, "Staff are continuing to go above and beyond looking after thousands of seriously ill COVID patients, while continuing to deal with higher levels of pressures for this time of the year. NHS services are continuing to work closely with social care providers so patients can be discharged when they're fit to leave." We contacted the Department of Health and Social Care to respond to this report. A government spokesperson said, "There are record numbers of doctors and nurses working in the NHS, with over 5,100 more doctors and over 9,700 more nurses compared to last year. We are doing all we can to support our health and care staff, including their mental health and well-being, with dedicated services like helplines and the Wellbeing Hub." NHS staff have rightly received a 3% pay rise this year, and we have provided record investment for the health service. Alongside this, we are committed to reducing vacancy numbers and growing the workforce, with 50,000 more nurses by the end of this Parliament.
We're launching the Omicron emergency booster national mission, unlike anything we've done before in the vaccination programme. To get boosted now, to hit the pace we need, we'll need to match the NHS's best vaccination day so far and then beat that day after day. This will require an extraordinary effort. And as we focus on boosters and make this new target achievable, it will mean some other appointments will need to be postponed.
Now, after nearly 2 years of COVID, the government is prioritising a vaccine booster programme to stave off the threat of the Omicron variant. As COVID-19 continues to take precedence, GP appointments and elective procedures will once again take a backseat. The British public have put up with a lot over the past 2 years. and the vast majority have obeyed lockdown rules in order to help keep the pressure off the NHS. But there are real problems. Unless ministers are prepared to look the NHS crisis in the eye and accept that they must profoundly improve recruitment, desperate patients may have nowhere to turn but their wallets.